Hi, my name is Alex Metzger, and this is blog number 4 for CHS 494. So, program planning is an important skill in the CHS major for many reasons. A graduate from our major needs to be able to see a problem, know how to fix it, and be able to implement that plan when it is needed. Anyone in our field needs to be a problem solver and lead the way in not only treating patients now, but preventing their problems from ever occurring in the future. One of the CHS classes that stood out to me the most in helping me develop my program planning skills was CHS 230, Introduction to Environmental Health. This class taught me some important skills for evaluating problems within a community and being able to plan and put into action a program to solve the problem at hand. This skill has actually been exceptionally helpful in my field studies because I am working on planning programs and workshops to help people with chronic diseases they may be dealing with now and figuring out ways to prevent other problems from arising in the years to come. I also feel that this skill will come in handy in my future career as a doctor. I plan to be an orthopedic surgeon, so I will need to plan treatment programs with my patients in order to make sure they have a safe and successful recovery from whatever injury they may be suffering from. Systems thinking is also an important skill to have in our major. Everything around us affects our health, including our environment, our biology, our social circles, and even our perception of the world and what's happening around us. It is important to be able to understand how all of these factors interact and accumulatively account for our current state of health. One of the classes that has helped me develop these skills was CHS 405, Spirituality and Health. This class helped me see how our local mind, which is our thoughts and experiences, and our non-local mind, which is everything around you, how they interact and influence nearly all aspects of your life. This has proved to be an important skill in my field studies because we're trying to make connections between chronic diseases and why they occur before they ever actually happen. I think it will also be an important skill when I'm a doctor because I will often need to think outside the box and bring all outside factors into account in order to correctly diagnose a patient and help them on the road to recovery. So currently in my field studies project at Access to Healthcare Network, I am working on finding chronic disease workshops and altering them so we will be able to use them in programs in Nevada to prevent chronic diseases like diabetes, COPD, and congestive heart failure. I'm also still working on creating a map based on zip code and percent federal poverty level, which we're going to use to determine where to best send our resources.